June is Men's Health Month, the perfect time to talk about essential health screenings for men and recommendations for a healthy life that all men should know. And I'm sorry, or maybe I'm not sorry, we're talking to a lot of the women out there who have those men that they love in their life. And so this is going to give them a little bit of ammunition for sure. Joining us for this discussion is Dr. Brad Thompson with Cone Health LeBauer Healthcare at Grandover Village. All right, first and foremost, let's just start with this. What are the most important health screenings that men should prioritize, and then at what ages?
Sure. So there are several important screenings. Just real quick. So screening is where we're looking for something so that we can prevent it in the future before we may even see any symptoms. So starting at age 20 is where we'll start checking blood pressure just to make sure that it's not getting high and we can prevent hypertension. Not too long after that, at age 35, we'll start looking at cholesterol and things that go along to prevent heart disease. Then at age 45, that's a time where we'll start screening blood sugar for diabetes, and we start screening for colon cancer. And then at age 50, that's where we'll talk to men about screening for prostate cancer. Now, sometimes there are different risk factors in people's lives that might change this earlier, but those are some of the big screening men should really stay active. Look forward to.
Okay, and I liked how you went through each one of the ages so we could see how that went. Now, are there certain screenings that some men often overlook but shouldn't overlook?
Yeah, so there are some things that are maybe not thought about by men as much that go along with health. Outside of the more medical ones that we've just talked about, there are things like mental health checks. Men may not tend to think about that as much or want to overlook that, but ensuring that you come in and we can screen for things like diabetes and I'm sorry, not diabetes, depression and anxiety, make sure we're not missing anything there. Skin cancer checks, a lot of times people don't think about that, especially when they go out in the sun in the summer. So just look for moles or any other lesions and we can follow up with that in the office. And then the last thing are testicular exams. Home exams should be performed, and if any abnormalities are found, they should talk to their doctor about it.
Okay. Now, I know a lot of guys, they only go to the doctor when they're really, really sick. Why is it critical? Let's talk about that. Why it's so critical for men to get their annual wellness check every single year.
So yeah, the annual check, people should come in, or men should come in for that because first, again, like the screenings, it allows us to catch things that could potentially be serious before you even have symptoms. It's a great time for us to also make sure that your vaccines are updated and any chronic managed conditions could be addressed at that time. It also enhances the relationship with the provider such that if a sensitive issue needs to be discussed, it's more easily done, and it allows you to get personalized advice based on your healthcare wants. So regular checkups are a great way for men to be proactive about their health and have a balanced overall approach.
Okay. Let's talk about maybe some myths that we could debunk while we're here today.
Sure. One myth that is often out there is just men don't need to go to the doctor regularly unless they're sick. Again, this is dangerous, and visits are essential for kind of that early detection. A second one is that mental health issues are a sign of weakness. I think that's false. Mental health is just as important as physical health, and seeking help is a sign of strength. The last one is that only older men need to worry about their health. Health problems can happen to anyone at any age, so young men need to be vigilant about their health. And my hope is by debunking some of these myths, it can encourage men to get the health care they need.
All right, let's talk about this. Maybe like some top health conditions among men that could be prevented with lifestyle modifications. I think a lot of guys say, well, I just don't want to be put on any medicine. So what kinds of things could be prevented if they change their lifestyle?
Sure, there are many common conditions that can be prevented with lifestyle. Heart disease, for instance, can be prevented through healthy diet and exercise, avoiding smoking. Similarly, type 2 diabetes can be improved by low carb diet, exercise, and healthy weight. Some cancers can be prevented by like quitting smoking can reduce your risk for lung cancer. So there are lots of things that you can do to really promote health and prevent a lot of negative things from occurring.
Okay. All right, we're going to continue this conversation. We are talking men's health and screenings that they should have. We'll be back in just a few minutes.